thanks for giving me this opportunity to talk about our work. I am going to try to do this quickly. I am not great at staying on time, so just like throw me down. This is my plan. I am going to tell you, as Melissa said, they did last year, talked about 20 years of work in 10 minutes. They gave me more time. I'm going to talk about what we've been doing the last 15 years. So tell the story of why and how cih.jhu.edu akapi was developed. For Lakota speakers in the room, I don't pronounce that quite right. I keep working on it. And then tell the story of how we're assessing the effectiveness of cih.jhu.edu akapi and what we've learned so far, and then share plans for the next 5 years. So I'm going to get 20 years in here, but some of it is aspirational still. And I do want to start with sharing pictures of our team, because I'm up here speaking on behalf of a huge group of folks that work to do this work and have been doing it since about 2009. So I'm not going to introduce everybody there, but just know it does really take a village to do this work, and it's critical. So how we started with this, we identified a need. I started out as a secondary data geek, analyzing longitudinal data on substance use in youth and trying to understand initiation patterns. And what we found from that was that the youth are at risk of initiating very early in this community that we work in. You'll see these are survival analysis curves. We're not going to go into detail, but basically the peak risk for initiation is starting around 11 or 12 years old. So this was really important data that we took back to the community, and we had a community advisory board. Even though it was a secondary analysis project, we thought it was really important to engage community in interpretation of these findings. So we took these data back to the community, and they pushed us and they worked with us. So first of all, they said, yep, this makes sense. This is what we're observing. They told many stories of what they were observing in their community. And they said, we get this. What are we going to do about this? And how are you going to help us with this? And I'm like, I'm a data analysis kind of person. Well, I don't know. But we needed to respond to the community needs. So the team, we had a lot of conversations with them about what did they think they needed to be able to address this and prevent early substance use for their youth. And I've gotten some yellow bubbles there. They said, we've got to focus before adolescence, because our data and their experiences said we got to get in there early to prevent this. They also said, we need to involve families. I mean, you all in this room know the disruption in parenting, the disruption in families that's happened as a result of colonization. Like, we can't do this just with the youth. We need to engage families. And they also said it needs to be cultural. We need to draw on the cultural strengths we have in the community. So with that in place, I'm thinking about, what do I bring to the table? I can write grants. I know how to bring in resources with the NIH. So we came up with a plan that we know the evidence-based piece, right? We need to start with an evidence-based program that will get us money. And then we need to figure out, how do we make that evidence-based program work for families? Because there wasn't anything out there that had an evidence base for youth in this age range with American Indian youth. So we went to see what else was out there. We spent about a year, maybe a year and a half, going back to have conversations with our community advisors. They're called the East Council. We went back to them and we said, here's what we're finding on these approved lists. What do you think fits with your community? And we specifically looked for things that focused on pre-adolescence, that involved family. We knew we were going to have to pull the cultural strengths in with the community. But we went through a lot of these. And in the end, the East Council chose the Strengthening Families program, the Iowa Strengthening Families program for families and youth, parents and youth 10 to 14. That's the long, really catchy name. But they said, this kind of aligns with what we want. It involves families, it involves parents and caregivers. It's got the right age range. And the way that it teaches the lessons is a way that seemed to resonate with the way they thought families would want to learn. So it's not going in and saying, this is what you do, but it's sharing examples and sort of pulling the knowledge that people have out within them. And they thought that we could make that work, adapt it for the community. So we went then, got this research grant to develop and test this really to develop and sort of pilot test the program. We used a multi-phase optimization strategy design. So we worked with Dr. Alicia Mousseau, who was a clinical psychologist and member of the community, living and working on the community during this process. She led this process. we went through the entire curriculum. We actually trained the East Council in the curriculum and said, where are the points that don't work for your community? And then we spent this time figuring out how do we need to adjust that. Alicia did a lot of work in the Lakota literature to say, how do we understand kinship roles and responsibilities? That was integrated throughout the curriculum. A lot of teaching kids about where do you fit? How do you belong? What is your role? What is your responsibility? And how are you enveloped by this family, right? This community. We remade the videos. The Strengthening Families program is very video led. And the videos for that program are a bunch of white people that look like me standing around their granite countertops, having these conversations with their kids. And people are like, yeah, that doesn't relate. So we hired local actors. We filmed in local homes and local locations. And we made sort of these low budget videos, but the families really respond to them because they see themselves in the videos. In a few cases, we had to change the script to make it something that actually made sense in community as well. And we also acknowledge the trauma. We know from our data in the community, kids are experiencing a lot of exposure to stress and trauma. So we brought that in more strongly. And we have a session helping parents recognize, understand how to see the signs that their kids are struggling with this and where to get resources for help. We also incorporated Lakota language. We went back and forth a lot on how much of that do we do. We really limited it to the kinship terms because the language has been disrupted so much that a lot of people don't have any experience with it. And we didn't want to overwhelm people or make them feel left out. So we have very targeted ways of incorporating Lakota language. And that whole process resulted in the cih.jhu.edu program. That name was given to us by one of the members of the East Council, a cultural language teacher. She says the literal translation of it is of home in which family is made strong, a sacred home in which family is made strong. And I think that communicates a lot about what we're trying to accomplish here. I'm not going to go into this in detail, but this is the sort of the way the program operates is families come together. There's a session, there's a meal that starts with all the families, parents or other caregivers. Many times they're not biological parents. It's, you can imagine a lot of grandparents, lots of aunties, whoever is raising the child. They come together for a meal, and then the adults go into one room and have some lessons, and the youth go into another room and have lessons. The youth lessons are very active and engaged, involve a lot of game playing. And then they come back together for a family session where they bring together the things they've learned separately. And it's a 7-week program where they come together one night a week for 7 weeks for this. It is led by local community members who've been trained as facilitators. And that's a picture of it. COVID was part of our experience, you could probably guess. We looked in that study, really the design, the purpose of that was to try some different additional adaptations and see what the best package was to build a final program. But we also just looked at preliminary outcomes and what we call proximal outcomes. So the things that were immediately impacted by the program, not the long-term outcomes of youth substance use, but just to see, are we changing the things that we think we're changing with this program that then are predicted to impact youth substance use in the long term. And what we found that youth were reporting stronger resistance skills, having the capacity to say no to offers for substance use, better stress management, more consistent and more frequent conversations with their caregivers about alcohol and drugs and their values around that, increased family cohesion, and just overall well-being went up for the youth. The adults reported more communication with their children, and again, specifically communicating their values around alcohol and drug use with their youth. More rule setting, more consistent discipline, more use of family meetings to bring the family together and talk about what do they want to do. And then one of the things that we're really looking at was increased cultural socialization, parents talking more about what they were doing intentionally to engage their youth with their community, with their culture, and with their cultural values. We also did some work, and Jared helped with this, social network data. And we found that the adults who participated in these programs together were building stronger bonds and are looking to their peers in the program to talk about challenges they were having with their children or look for advice for their children. So this is what we're hoping with this, is it's not just what you learn in the session, but you build those relationships and connections that then sustain you after the program is completed, and you carry those forward. So that's what we did. I don't even know where I am on time. Then we moved into an effectiveness trial. So we went back to NIDA, to the National Institute on Drug Abuse, and said, now we're ready to do a randomized control trial. We want to test this. We recruited our first cohort at the end of February 2020, and then we sat around for a while. It was really 2 full years before we were able to get back into the community and bring families together in a way that is necessary for this program. And we were initially going to follow families for 3 years after they participated, then it went back to 2, but now we got some more funding. We're able now to follow them for 4 years. We finished our last cohort last December, and we've just gotten the first round of semi-annual follow-up data on them. So we're in the process of analyzing those quantitative data. We've done some qualitative interviews and learned that mostly with the parents, we've done some with youth, but mostly with the adults and other parents and other adults, they reported a high degree of satisfaction with the program. They really felt like the program was impacting the way they interacted with their youth and knowing how to help their youth through this challenging time of transition into adolescence, and really appreciated the opportunities that the program gave them to come together with their youth in this setting and really focus on building family strengths and helping their youth have the skills they need to be more resilient in adolescence. This is just a chart showing kind of how the flow of our program is. We also have a comparison group that we look to the community to say, what should that be? It focuses on nutrition, healthy eating, and exercise, and how families can be healthier in that way together. So that's what the families randomized not into our cih.jhu.edu akapi program got. The other thing we did is we found it was really challenging for families to get there 7 weeks in a row for 2.5 hours a night, transportation issues, basketball games, all the things that come up that you can't get there. So we just this summer piloted condensing that 7-week program into a weekend. And we got this idea from Lorinda Ballone and her team at University of New Mexico, because some of their community partners did this and it worked really well. We're like, we're copying you. So we took 8 families from the reservation up to a border town. We put them up in a hotel that has a water park. We brought them in on Friday evening, had a session Friday evening, brought them back Saturday morning. We did a couple of sessions Saturday morning, fed them lunch, did another session, and then gave them water park tickets and said, go have fun with your family, because that's part of what this is to be, right? And then we brought them back Sunday and finished up the 7 sessions that way. There's some challenges to that. There's not time in between the weekly sessions to go home and practice and do the things that sort of let this soak in, right? And let you really make it your own. But in contrast, all the families got all 7 sessions. They got all the material. And that was very unusual for us to get all the families to all 7 sessions the way we were doing it. So there's pros and cons to that. We did this thing called the Sunday survey before they left. We made them answer a short survey about how they thought it went. We also collected pre and post data, and we're analyzing that to look at proximal outcomes just in those 8 families. But we wanted to do this because that's important for the next steps that I'm going to tell you about in a minute. And I'm out of time, but I do want to say this. These are some really critical approaches we've learned through all of those 15 years to date. Really centering I'm preaching to the choir here, right? You guys know all of this. But we actually wrote a paper that's under review right now that we're hoping we can get these messages out more broadly, right? That we really, really, really need to listen to those parts of those community members on our team who are living and working in the community about how to do this work. We can do our work in Denver and we have these ideas and we have these approaches and methods we bring, but we really have to be responsive. And the pandemic taught us that really, really deeply. And when did we need to take a pause? And when did we need to rethink the way we were approaching that? And then I'm just going to tell you really quickly, this is where we're going next. We have 5 more years of funding to do an implementation study. And we are that top panel where this is what is allowing us to follow families longer than we got sort of cut off at the knees with the pandemic to do. So we're following families for 4 years. That's part of it. The other part of it is we're partnering with community organizations that already serve families on the community. And we are going to bring them together in a community of practice, train them in how to deliver this program. And then we're just going to watch what they do. how do they take it and make it their own? How do they make it work in their communities, in their programs? So this is the sustainability piece. And we're really hoping we're going to learn some good lessons from them at the organizational level, at the facilitator level. How do we support those facilitators to really do this work well? And then at the family level. So this is really our next step. And now I'm becoming an implementation researcher, so learning it as I go. But that's our 20-year progress and plans in a nutshell. And thank you very much. And if anybody's interested, I'd love to talk to you more about that.